Hey guys, this is Kara from Karathebabynurse. I just wanted to take my postpartum course, class, presentation, whatever you want to call it, and put it right here where anyone can get access to it anytime. And so let's just hop right in. I think this will be about 30-45 minutes. We'll see, but I hope it's helpful. Basically, this is everything I teach my patients in the hospital, just all the things I wish I knew before I was postpartum. Let's jump right in. Okay, so about me, I am a mom of three. I had babies in 2018, 2020, and 2022. I worked in oncology for a year and a half, but I've been a mother baby for 5 years, and I just absolutely love it. I love my job. Um, if you don't know already, I'm the social media creator of Care the Baby Nurse. It's on all the platforms. I'm on Facebook, YouTube, TikTok, and Instagram. I wrote the book, Why Didn't I Learn This Parent Stuff Sooner? And the Tried and True Baby Sleep course, Why Didn't I Learn All This Sleep Stuff? Why didn't I learn all this sleep stuff sooner? That's a mouthful. Basically, what you need to know about me is I'm super passionate about people advocating for themselves. I'm never going to judge you for what you decide to do. I'm a huge fan of informed consent. Like, once I tell you all the facts, all the things, the risks, the benefits, all that stuff, you are an adult and you can make the best choice for you. And I'm just there to support you. And, that's just me. So let's jump right in. Okay, things we're going to talk about basically preparing your house and home, your home, like the people around you, as much stuff as you can prep ahead of time. We're going to talk about that. Caring for your body, caring for your mental health, kind of getting your team assembled, your partner, your friends, whatever, just making sure you have like a good support system ahead of time, and boundaries, just how to set healthy boundaries for yourself so that you are set up for success. And one thing I just want to point out is that so many people prepare for pregnancy and not a lot of people prepare for postpartum. Like, you spend 9 months thinking about this baby and preparing for the birth, and then postpartum comes and it hits you like a ton of bricks. So it really caught me off guard, which is why I wanted to have this little resource for people because I wish I had had it before having kids. So let's talk about getting your home ready. So obviously y'all have all seen the cart, like the one pictured here. You definitely don't have to do a cart like this. You could just get a little basket or something, but I would invest in some things, some pericare things ahead of time. Now, keep in mind, the hospital, we really do have everything you truly need. And we'll give you a bunch of stuff, but it does kind of depend on the hospital. So that's why I always just say, just in case, stock up on some stuff ahead of time. I would at least keep some stuff in a easy to access area in your bathroom. So like whether it's in a basket or a cart like this, or just something where you can get to it all. Depends, pads, peri bottle, witch hazel, benzocaine spray, all that stuff. I would also set up doom baskets if I were you. So like whatever room you're going to spend the most time in your house. So like, let's say you're like, oh, I know I'll be in the living room a lot with my baby, or like if you have a toddler or whatever, and you're going to be upstairs, like in a playroom with them. I would have like just a little basket in whatever room you're going to be in a lot, with like one extra little outfit, some diapers, some wipes, so that you're not having to run back and forth to wherever you change baby. If you keep all their diapers and whatnot in the nursery, it's just kind of annoying to run back and forth. So I just keep an extra, just little basket of things wherever you're going to be. I would get a belly binder, especially if you're going to have a C-section. It's just like optional if you're going to have a vaginal delivery, but it's really helpful with a C-section. Stool softeners, snacks, medications, and even think about setting up a meal train. If anyone offers like, hey, what can I do ahead of time for you? Tell them to make you a meal train. Okay, let's talk about your body changes. So other than just, there's a lot of things going on, but these are a lot of kind of maybe like smaller things that you might not realize happen to your body. You might have swelling. Obviously, people kind of, I think, know about it being in your feet, but a lot of times it can also be in your breasts. And this can just be because partly, during labor and delivery, a lot of times they'll give you fluids in labor. They'll give you lactated ringers or saline or whatever. Sometimes it is medically indicated. If your blood pressure is dropping or baby's heart rate is funky, they'll want to give it to you. And that's fine, but just keep in mind that sometimes when you get those fluids, they are going to go to it, the fluid is going to build up. We call it edema in areas that are dependent from your body. So like your feet, your hands, um, it can be in your breasts, which a lot of people don't think about happening, which can cause a problem with breastfeeding, because your areola will kind of be edematous, so it makes it harder for baby to latch. So just keep that in mind. Usually it gets a lot better after a couple days. So if you're like, oh my gosh, this is like so stressful and what's going on, just know that it's going to get better once that fluid just kind of comes off your body. You might be really sore. You might have body aches, which is pretty typical from like just pushing and just all of the strain and what's going on with your body. Your uterus, it does take time to shrink. So keep that in mind. You still might look pregnant for a little bit, and that's totally normal. You might have some back pain, especially if you had like back labor, which is where your baby's back of their head is kind of pushing on your spine, your sacrum at the bottom of your spine. So you might have some back pain. You might have some dizziness from loss of fluids. You lose a lot of blood typically during labor. During birth, and that's pretty normal. But that plus like anesthesia and just the big fluid shifts that your body has gone through with delivery, you might feel some dizziness, and that's pretty typical. Just make sure you let your provider or your nurses know if you're experiencing that, because we just want to make sure that you're safe getting up and that you're not going to fall or anything like that. You might have hemorrhoids. That can be common from pushing. Hot flashes, sweating, that's just due to all of the fluctuation of hormones after your delivery. That's very normal. So don't be surprised if you feel just some pretty crazy mood swings or just hot flashes or very intense sweating. A lot of people really like to bring a fan to the hospital with them. That's super helpful. And constipation, again, from just like meds we give you after delivery, from just like not moving as much. You're usually kind of in the bed more. And I don't know if I already said meds, but yeah, meds, not moving as much, not drinking as much, losing a lot of fluid. So that's pretty common as well. Okay, let's talk about how to do pericare. So when you get up to the bathroom for the first time, this is what we're going to do, and this is what we're typically going to recommend you do for the first couple weeks after delivery, as long as you're kind of bleeding. So you want to rinse your vulva off with lukewarm water with the peri bottle. You're going to put a new pad in your underwear. You can wear like the hospital briefs. You can bring your own Depends if you want. I think the Depends are a lot more comfortable and just, I don't know, they just fit better. So I would recommend bringing those to the hospital with you, but you can totally just use the free ones at the hospital. This is optional, but you can spray benzocaine on your vulva. You can put an ice pack on top of your pad. You can put a little witch hazel on top of the ice pack. Like we're literally making a little pad sandwich. So all of that stuff, you can use all of it. You can just use some of it. You don't have to use all the things, but it just really helps if you had any kind of tearing or have swelling. Usually we only do ice for like the first day to help with any kind of swelling. I don't know that it's very beneficial after that, but if you do have some pretty intense swelling, you can definitely use it for longer. Whenever you're done, you'll just lightly pat the vulva if you want to with some toilet paper, but really we want to try to avoid rubbing or scrubbing, and it's always important to make sure you're wiping front to back. So Lokia changes. This is just how that blood that you're going to notice in your pad changes over time. Keep in mind, everyone, this is going to vary, so it's not like it has to be exactly this, but this is just kind of the typical presentation. So your bleeding, we usually call that Lokia rubra. The first 3 to 4 days, it's that bright, dark red bleeding. It'll kind of change around week 2 into from day 4 to like 2 weeks out, it's going to be like a pinkish brownish color. This is called Lokia serosa. And then the 2 week to like 4 to 6 week period, it's going to be Lokia alba, which is the thin yellow to white kind of bleeding. And just keep in mind, if you are like doing too much, like if you are like your bleeding was, let's say it's serosa, you're 2 weeks out, and then like you try to do too much, like you're like, I feel good, and so you're like cleaning around the house and you're doing all this stuff, then your body's probably that bleeding will kind of revert back to like more of a rubra color. And that's just a sign that your body's telling you you need to slow down, you need to rest. Because if you try to do too much, that bleeding is going to pick up. So just kind of listen to your body, watch that bleeding, and make adjustments if you feel like you need to. All right, what does the first day in the hospital look like? So this is just like my hospital. Obviously, it's going to vary based on the hospital, but the first 4 hours is kind of the most busy time. Definitely, we are going to prioritize that golden hour as much as possible. That is extremely important to us. And please, like, if you feel like you're being bothered unnecessarily, don't be afraid to say something, but we try to be really good about that golden hour. We have you stay skin to skin if that's what you want to do. We really try to limit interruptions as much as possible. You definitely don't have to do babies' measurements. Like, we'll get the weight, their length, their head circumference, all that. But you can wait until after that golden hour. That is not like a necessity that has to be done right at delivery. So just keep in mind, baby can be born if in a vaginal birth and everything is safe, like if everyone is stable, then baby can go right on your chest and just stay there. We can do our vitals and check their heart rate and everything while they're on your chest. And then we really need to just kind of leave you be. We will come in and do fundal checks on you or fundal massage. You're just most likely to hemorrhage in the first 4 hours after delivery. So that's why we kind of just pay extra close attention to you then, which I know is annoying. You don't want to be bothered, but that's why we are just kind of being extra careful with you. After that, it'll definitely not be as intense and we'll kind of leave you alone more. Okay, so then, like I said, well, let me just mention real quick. So that first 4 hours, we're doing a lot of checks, but then after that, usually we don't need to do a fundal check, except like every 4 hours, and then after a day, we only do it once a shift. So it definitely decreases and backs off. So a lot of people want to know, when can my IV come out? So you can, technically, really, it can come out, I would say, anytime, if it's bothering you or it's painful. But like I said, I mentioned you're most likely to hemorrhage in the first 4 hours. So we really do like you to try to keep it during that time, because if we had to give you Pitocin or any life-saving medications, I would prefer that you have your IV in then. But typically what we do, my hospital's kind of policy or rule is like once you've voided 3 times on your own. So, a lot of times if you have an epidural, and for sure if you have a C-section, you'll have that Foley catheter in. So once we take the Foley catheter out, we just want to make sure that you can pee on your own by yourself. And so once you've peed 3 times, then we'll take the IV out. This is going to vary probably on the hospital though. But I usually tell people, wait for it to come out before you take a shower, because it's just a lot easier to get in the shower once your IV is out. But you can totally wrap your IV up. We have like a special wrap that we can put around it that's waterproof, so you can get in the shower sooner, and that's totally fine if you want to do that. We're totally there to help you, assist you with feeds and bonding, as much as you want, or if you want us to be a little hands off, you can totally say that. Just like let us know kind of where you're at, and we're going to meet you there. So make sure your nurse is clustering your care too. If they are kind of bothering you a lot and it's like things that you feel like could be done together, for example, if you have medications and a fundal rub due, we like try to cluster that together. If you feel like they're not doing a good job of that, just like let them know. You can let them know nicely that it's a priority for you to minimize interruptions. You can definitely tell them that. All right, so setting yourself up for success. These are things that I would talk about ahead of time, or think about ahead of time, talking to the people in your life about. Do you have a plan with your provider about your mental health? So if you need to have a conversation about meds or therapy or resources you might need after delivery, who can you call or rely on? Do you have like a go-to person, a friend who you can call if you like just, I don't know, are in a pickle and you need some help? Setting up expectations with your partner. So how can you split shifts at night, or who's going to take care of the household duties? I have a friend who, when she had to go back to work, she was worried about being up at night with the baby. So she would take the first half of the night And then her husband would take the second half of the night if baby had any wake up. So that way she knew she'd at least be able to get sleep the second half of the night. So think about things like that you might be able to do. Do you have a game plan to get out and do things that are going to be fulfilling for you? Because it's still important for you to get out, do stuff that you enjoy doing. So I even like to go ahead and make plans when I'm pregnant. Okay, like when I'm 2 weeks postpartum, I know I want to go like get a haircut or something. So just like going ahead and lining that up, or having things that you can do for yourself without the baby. Or if you want to take the baby, that's fine too. But whatever is going to be the best for you. Is there anything that you can outsource, like a meal train or a cleaning service or anything like that? If people ask you what ways they can help, don't tell them no, because usually if people offer to help, they typically really do mean it. They are sincere about it. So if they want to sign up for a meal train, say, hey, it'd actually be really great if you could like sign up for my meal train or create one, or like just anything you can outsource. Think about how you're going to handle visitors, and setting boundaries with them. That's really important. Just you can do it in a very kind way, but just say like, hey, we really want to prioritize our health and our bonding. So we're not going to have any visitors the first week or two. So whatever feels the best for you. All right, let's talk about your body recovery. What does it feel like after a vaginal delivery? So you might be very swollen down in your labial area. That's pretty common. It might feel heavy just with all that extra blood flow. Your stitches might be kind of itchy. We already talked about how to take care of it down there on the previous slide, so I won't get into that. And just precautions, making sure you're not lifting anything really heavier than your baby for at least, I would say like a week, but that's more kind of with a C-section. You just don't want to strain or be lifting anything very heavy, because that's going to put pressure on your perineal floor and it can hurt if you have any kind of stitching or anything like that. Just don't overexert yourself. Make sure you're elevating your perineum throughout the day, not doing too much cleaning or too much walking or anything like that. You need to prioritize resting and laying down. Even if you feel like you're okay, it's just still important to take that time. And even look into taking sitz baths. Those are super helpful as well, especially if you have itching from stitches. A lot of people really like that. All right, for a C-section, what does that feel like? So you still might have swelling, which a lot of people don't realize, especially if you were in labor beforehand. You might even have pushed before you ended up having a C-section. So you can still have swelling. Your incision might be tight, itchy, but the biggest complaint I feel like people have that catches them off guard is gas pain. Because whenever they cut you open, the air is going to get in your abdominal cavity, and that air rises because, air is going to float up. So you might often have pain up in your shoulders or your back, it's very, very common, and that's just gas pain. I mean, definitely you need to tell your provider if you notice it, because we just want to make sure that you're okay, everything's fine. But yeah, if you feel gas pain, super common. And you can take things like a Gas X, but really the biggest thing is walking. That's really going to help get that air moving and get it out. You clean, rinse off perineal area just the same as a vaginal delivery. Just make sure, and we'll talk about this in a minute, make sure that you're not soaking or getting in any bathtubs until you've been cleared your provider. Usually it's for at least 6 weeks. And that's not only because of the incision, but also because of where the placenta came away from your uterine wall. We just want to make sure that wound basically inside your uterus is healing, and just any kind of water in there can impair skin breakdown. So we just don't want that. You can shower like normal, just pat, no rubbing, no scrubbing. Don't lift anything heavy, again, just like a vaginal, but you need to be a little even extra more cautious about this with a C-section because you have that incision. If you have to cough or anything like that, you can definitely brace with a pillow. Belly binders, a lot of people really like that when they're up and walking, moving around for the first couple weeks. And like I said, walking and Gas X are super helpful for gas pain. You want to limit motions like going up and down stairs or things that are going to strain your pelvic floor or just make it harder on your pelvic area. So just try to limit that if you can. This is applicable for vaginal and C-section deliveries, but nothing in your vagina for 6 weeks. No tampons, no penises, nothing. So you just want to Let that area heal, even if you didn't tear and you're like, oh, I think I'm fine. Again, remember, it's about where it's where the placenta separated away from your uterus. You have that big dinner plate size wound there. You just want to make sure that it's all healed up. No tub baths, no swimming pools, hot tubs, nothing for 6 weeks until you're cleared by your provider. Please keep in mind that even if you're cleared by your doctor and they're like, yep, everything looks good, if you're like having sex or you're just in, like walking, peeing, pooping, anything just doesn't feel right, it's really uncomfortable, it's painful, please either tell your doctor again, or if they're still kind of dismissing you, advocate for you to get a pelvic floor consult from like a pelvic floor physical therapist or a pelvic floor occupational therapist. Just make sure you're talking to someone who can maybe give you another perspective, because they are like so educated in that whole area. They're so knowledgeable, and they might catch something that your provider might be missing or have just some insights. So I think that that's super helpful, and I would look into that. All right, so this is reasons to call your provider. So if anything makes you think that you have some kind of an infection, whether it's in the vaginal area or your C-section incision, funky odor, drainage, hot to the touch, you have a fever, which is a temperature over 100.4, bleeding if you soak a pad through in an hour or less, that is not normal. Clots bigger than a golf ball, little clots are fine, but if they're big and they're like hard or they're round, please tell somebody. Mastitis symptoms, which is like, you get a clogged milk duct and it gets infected. So usually it starts off if you feel it like a little lump where there's a clogged milk duct, but then it can become hot to the touch. It's painful, swollen. You might have fevers and chills. And it's like, it feels like you're dying. It is not pleasant. So if you feel like it's starting, just please say something sooner than later, because if it gets really bad and progresses far, it can get to a point where you have to be hospitalized and get IV antibiotics. So it's better to just tell them sooner than later, because it can progress very quickly. So just call your provider if you start to notice those symptoms, if you have a clogged milk duct. Mood swings where you feel out of control, like you feel unsafe or your baby is unsafe, please put your baby down in their crib and call someone, whether it's a friend, you need to call a hotline, whatever. Just don't wait too long. Just please say something sooner than later. If you're having a hard time peeing or pooping, also let your provider know. If you might need like just, something stronger, like a suppository or something. It's like I said, it's typical, just dehydration. You've lost a lot of fluids. You're typically not drinking as much as you should be. It's just that stuff can be, or if you've had a catheter, that can like cause some issues with peeing. So just make sure that you say something to your doctor if you notice like it's been a long time or painful with either of those things. Chest pain or sharp pains in your legs, that can be a sign of a blood clot. So you're just you're higher at risk or prone to get them after childbirth. Of course, it's very rare, but just err on the side of caution. If you notice those, please let someone know ASAP. If you have any dizziness, blurry vision, headaches, that can be a sign of high blood pressure after birth. So please let somebody know. That's very important. Don't dismiss that. And just honestly, if anything just doesn't feel right to you, like no matter what it is, if something just feels wrong, trust your intuition and just let your provider know. Okay, so since everyone is scared of pooping after delivery, let's talk about that. So it's really important to drink a lot of water. I always say invest in a good cup, like that's going to keep your ice really cold, so you're going to be more motivated to drink. You can definitely take stool softeners, Miralax. You can call into your provider for like a suppository if you really need the big guns. Magnesium, Senecot tea, probiotics, all that stuff is really helpful. Make sure you're not straining. You might even want to think about getting like a squatty potty, but really just the big ones I think are making sure you're getting some movement. Obviously, I've told y'all you need to rest and prioritize laying down and elevating your perineum, but it's also important to make sure you're getting some movement throughout the day. All right, let's talk about communication with your partners. So like I said earlier, talk about maybe splitting the night into shifts, or even the daytime, honestly, if you feel like you need to do that. Discuss your fears and concerns ahead of time with them, things that might be a strain or a trigger on your mental health. Like, hey, I know that I don't do well when I don't get enough sleep. Like, how are we going to work on this and make sure that I'm getting what I need so that I can safely and effectively take care of our baby, or our other kids, Make sure you're still setting aside time to talk and listen to each other. Make sure they feel like they're an active participant in bonding. I know sometimes, like, the other partner can feel like maybe they don't get to be as involved with the baby, especially if you're breastfeeding and stuff. So make sure that they feel like they're getting stuff that they get to participate in. Maybe they get to always do bath time or something like that. Just make sure that they're feeling like they get to bond with the baby as well. Make sure you give each other scheduled breaks. That's really important. Set aside time that you know that you've talked ahead of time that you're going to be able to have. And then this last one in the middle, this is just kind of like a fun little thing that I heard someone say one time, and I think it's a good tip. But spotting each other a percent based on where they're at, like just checking in with each other throughout the day, like, hey, I'm at like 30% right now because I'm so tired and sleep deprived and hungry or whatever. And then see where they're at. They might say, well, I'm at 70%. I'm actually doing like decent. I can actually spot you like another 20%. How about that? So, and then maybe they take the baby for a bit so you can rest or you can get something to eat or something like that. But just kind of checking in with each other and seeing how you can meet each other where they're at and like help, kind of help take the burden off of them. For meal tips, I would definitely prioritize protein for wound healing. We know protein helps with muscle repair and just wound healing. So keep snacks around the house that are going to be quick and easy, but also high in protein, like jerky, granola bars, etc. I like things that are already made or very minimal effort after the baby comes. So like rotisserie chickens, you could even freeze them, soups or crock pot meals. Things that are already like sort of prepared, like a bagged salad, but you just add a boiled egg or an avocado on top for some extra protein. You can make crock pot meals, so you just dump it all in there in the morning so it'll be ready by the evening is really helpful. Smoothies, like you can just add in things like peanut butter, spinach, or whatever. Oatmeal that, things like oatmeal, fennel seeds, brewer's yeast. That stuff helps with milk production. Just finding like little ways you can throw it into meals that you already like or eat. All right, so signs of baby blues. We're going to move into kind of mental health stuff right now. So baby blues, both parents can experience baby blues, which I don't know that a lot of people know that. Signs can include restlessness, fatigue, insomnia, headache, sadness, and anger, but it's usually mild and it's typically pretty short-lived. So I would say it's pretty common. When we start to kind of get more concerned is when it moves into postpartum depression. So this is where it gets a little more intense. Pervasive feelings of sadness, severe mood swings, feelings of guilt, anxiety, panic attacks, spontaneous crying. You definitely need to tell somebody if you experience any of this stuff. You might need therapy, medications, support groups. You might need to prioritize more of what you're eating in your diet. Just please tell someone. The triggers are things like lack of sleep, being isolated, not getting time outside, nutrient deficient. Your whole life has really fundamentally changed after having a baby. Like your body has changed, literally your entire life, and you as a person have completely changed. So, I mean, it's completely understandable that you're going to go through not only a huge shift in just like being given this little person that you have to take care of, but also like you have changed as a person and you have to like basically learn who you are all over again. And so just take time and be easy on yourself with all the things that have changed. And also, make sure that you are seeking out help if you feel like it's gotten to this point where if you've reached postpartum depression. I can't emphasize that enough, that I feel like people make it seem in our society that you should just feel grateful and lucky that you have a healthy baby or whatever. But it's really important to take care of your mental health too, because in order for you to be an effective parent, you have to in order to take care of your baby safely, you have to take care of yourself first. So just keep that in mind. All right, moving on to postpartum psychosis. I wanted to talk about this because I don't feel like you hear about it a lot. It's not not common at all, but it's super, super important to talk about. It's similar in when it first kind of appears as postpartum depression, but then it moves into kind of a little bit more of a scary zone where it's like inability to move, work. You're confused, incoherent. You have obsessive concerns, delusions, or hallucinations. It is a psychiatric emergency that may require hospitalization. So just be aware of that. I want everyone, I hope everyone knows about this, because there have been instances of people, parents getting it, and it's led it to um, death or injury of either the baby or the mom. And a lot, I don't want to say it would have been 100% preventable, but I think that there were definitely signs that people should have known to look out for, and it might have prevented serious injury. So I just want everyone to know about it, and I want your partners to know about it. So if they ever notice these signs or symptoms in you, to get you help sooner than later. So how long does healing actually take? So it isn't just 6 weeks. I've even heard, like, okay, for one thing, some of the doctors that I work with have told me it takes just like your blood levels to get back to normal. It takes about 6 months for that to happen. And then, like, for your hormones and all of just literally everything usually takes, like, I've heard upwards of 2 years. So just keep that in mind. It's not just 6 weeks. So if you don't feel right, like with having sex or anything, if you're having incontinence, even by being cleared by your doctor, I just want you to go see a pelvic floor physical therapist or an occupational therapist. Just know that, like, oh, okay, I should be good to go at 6 weeks for sex, or for just like even just your mental, like people might say, oh, you'll be back to normal at 6 weeks. Just know that it's totally okay, normal, if it takes you longer to kind of get back into a headspace where you feel more like yourself. Okay, for setting boundaries, just keep in mind, I always tell people this, but you are their parent, and you're the one taking care of them. Um, they are not. So when somebody gives you unsolicited advice, or is like, oh, just bring the baby to like a dinner at 7 p.m., I just be like, respectfully, you're not going to be the one home taking care of them tonight when I go home. So, like, please respect my boundaries. If I say no, definitely be willing to work with them and stuff. But you're their parent. So, it's like people need to understand that. So set time limits for visitors. Don't feel guilty if people are like wanting to drop in, but it's really not a good time for you. If you just want to say, hey, like, I really actually like you, if you can just leave the food outside, that would be preferable, because now is not a good time. If someone genuinely does care about you, they will respect your boundaries. I promise. If they are making it about them, if they're disappointed or upset for you not letting them see the baby or whatever, then, I mean, I don't mean to be rude, but like, they're making it about themselves. They really don't care about you if they're being like that. Someone who genuinely is a caring person and cares about you is going to be understanding of what you're going through. So, anyways, just want to throw that in there. You can still let people bond and be a part of your family with healthy boundaries. You're the one there responsible for the baby around the clock and responsible for their care. They are not. So, all right, let's talk about your milk coming in. It can be painful. I wanted to throw this in there because this was something that really was bad for me with all three of my kids, and I didn't feel like I was prepared for this. Just keep in mind, it can be painful. It's like a big change in your body. We always use cold for engorgement, never heat. I know that there used to be stuff about putting heat on your breasts, like for mastitis or before a feeding, if you have a clogged milk duct. And the guidelines on that changed, I believe, I think it was 2022. Really, we are not really supposed to put any kind of heat on your breast, because they've found that it can lead to more inflammation and just make things worse. So really, we just want to use cold. There's those hydrogel pads, which are amazing. Silverettes, cold packs, nipple cream. Like, they make there's those like Lancino cold packs that are made specifically for this. They're like shaped like your breast and go on your boob. And those are amazing. So definitely look into that. You can take ibuprofen and Tylenol to help with just like the kind of the pain and the engorgement. And just make sure you're wearing a well-fitting bra, the correct type of bra. That can really help too. Just want to make sure it's a good, comfortable nursing bra that's not cutting into any areas. Like an underwire bra is probably not the best because it can kind of cut into that tissue and actually make you more prone to getting clogged ducts. So just make sure you're aware of that. And lastly, give yourself grace. Like I said, it's a big change, and don't hold yourself up to standards that anyone else has given you. Everyone's postpartum journey is going to look completely different. And each of mine, with my 3 kids, was very different. And I learned a lot about myself, and I learned how to handle it differently each time. So just know that you're doing a great job. And that's the conclusion of our presentation. I hope you guys learned something. Please reach out to me if you have any questions on my social media page. I really do try to check my DMs, so you can get a hold of me at Karathebabynurse on Instagram or TikTok, YouTube, Facebook, all the places. And I hope you enjoy. All right, have a great day.